In terms of the latest research, women that have a high level of fitness, that are accustomed to regular, vigorous exercise, are still allowed to train during pregnancy. There's no research to suggest that it's harmful to the baby. And this is the message that we're trying to get through to people. Obviously, you need to tailor it and we need to modify it, but the latest research has shown that it's not harmful. The New Zealand exercise guidelines currently say, and they include aerobic exercise most days, strength-based exercises at least 2 days a week. And then in terms of weekly routine, you want to be doing 30 minutes, if not more, most days of the week, with a combination of moderate intensity, 2 to 5 hours a week, or vigorous exercise for up to 2.5 hours. Alternatively, you can do a combination of the two. So this is what the New Zealand guidelines currently say. So now knowing what the guidelines are, how do you train your pregnant client? You need a baseline understanding of what you need to adjust and what those modifications look like. You also need to confidently be able to cue the abdominal draw-in maneuver, which you'll learn soon, and pelvic floor activations. You also need to know when to refer out. If this is not in your scope of practice, that's absolutely fine, and you can just refer it on to your MO or to a women's health physio. So let's do a demonstration on what pelvic floor activations look like and some progressions through that.
So I'm just going to explain pelvic floor activation. So this is something the pelvic health physio would typically set the client up with, but it's good for you to know what the prompts are, and then you may bring these into your exercises with pregnancy and postpartum. So Alice, what I want you to do is a couple of cues you can think of is trying to stop your urine flow. So I want you to squeeze and lift between your legs. You'll feel it at the front. So that's one prompt. Another prompt is if you relax again, if you try and stop any gas, so stopping any farts, squeeze, and then try and lift at the front through to the front pubic bone. Yeah. Another way to think about it is drawing your two bones together. The pubic symphysis at the front here and the tailbone, imagine drawing those bones together. And then there's lots of other cues, like sucking a blueberry or walking into cold water. Lots of them. So that's pelvic floor activation.
We're now going to jump in and learn about how to do abdominal draw-in maneuvers. Okay, so how you would use this with your client when you're about to start a workout is, first of all, you'd get them to do their belly breathing. So one hand on your chest, one hand on your upper belly. Shoulder blades relaxed, yep, and just making sure your spine is neutral. From here, you're inhaling through your lungs, filling your lungs, expanding your rib cage as well as your lower belly, so your hand raises, and then on your exhale, you should see the hand just drop down nice and gently. That's your belly breathing. Once you've had your belly breathing, we want to make sure that you can engage your transverse abdominis, or your ADM, your abdominal drawn maneuver, okay? So you're looking to place your hands on either side, find your hip bones, and just take two little fingers in, yep, and just push down a little bit. So when they're in a neutral position, as mentioned, it's nice and soft. And then, so you inhale here first. On your exhale, you are going to try and draw these two hip bones together. So you're just looking to get transverse abdominis activation here. Can you feel that? And then again, you're releasing with control. Once you've got those two things, you feel that, so the core is engaged, we're going to layer it now. So can you bring your hands together? Yep, you're also going to push your knees together. So this one's just going to be down on the ground. We're not going to lift our hips. So you inhale first. Good. On the exhale, so we're looking to get pelvic floor engagement here. You're going to push the hands together, push the knees together. You're going to lift up and in. So squeeze and lift, trying to get that pelvic floor engagement as you're exhaling. One more time. Inhale. A good thing here is to help them, let them do it in their own time with their breathing so they can kind of get that mind-body connection of feeling the pelvic floor. Second layering technique here is once they feel like they can engage that, you can progress. So now we're going to scoot the feet into the glutes. You're going to move on into a glute bridge, which we know how to do that anyway. But again, it's just layering it and being mindful of ab engagement here. So inhale first. On your exhale, you're driving through the heels, lifting the hips nice and high to the sky, and you're engaging pelvic floor here and lifting up and in from the pubic bone up towards your belly button. Can you get engagement there?
Mm-hmm.
And then curl through your spine, one vertebrae at a time, taking your time to get a bit of a nice stretch through your back and all the way back down to the ground. How's that feel?
Good.
Excellent. The reason we do abdominal draw-in maneuvers is because it supports the whole process of pregnancy and postpartum. It protects your spine, the growing fetus, obviously as it grows and your body weight shifts. The centre of gravity, as I just mentioned, labour and delivery, as well as early postpartum. So it's super crucial for getting it right and early. So now you've had a really general overview of how to train a woman during pregnancy. Then we're going to go into trimester 1, where fatigue is first. You want to make sure that's your focus. Then we dip into trimester 2, which is where you can explore when they're feeling great. And then trimester 3, fatigue comes first again.